I think perhaps in the interest of time that I'll start with the introduction already now. I see that people are still joining in, but so that we don't lose time from our speakers this afternoon or morning, depending on where we are. So I would like to begin by welcoming all of you to this joint webinar on victimization, suicide, and coping among vulnerable youth who has used drugs during the COVID-19 pandemic. This is a joint webinar hosted by WFAD and Uganda Youth Development Link. And my name is Regina Matson, and I will moderate the session today. I represent WFAD, which is a global umbrella organization with NGOs and individuals who work to prevent drug use, increase access to treatment, and to promote recovery. As we all know, our world has seen a significant change in the past 2 years when governments, civil society, and people alike have struggled with the new challenges posed by the COVID-19 pandemic. One group that have been particularly affected by lockdown and other restriction measures are young people, who in many places of the world have been more isolated due to closure of schools and after-school activities, as well as other hardships that have been posed by the pandemic. So the session today will highlight a study carried out on factors associated with suicide, victimization, and coping among vulnerable youth in Uganda who have used drugs during the COVID-19 pandemic, as well as among vulnerable street-connected youth in Nepal during the pandemic. So with us to do so and to highlight this important topic are three prominent speakers whom I will introduce now before we start off. And I'll ask my colleague to show us the first picture. Thank you, Cressida. So first out is Rogers Kasirye from Uganda Youth Development Link. UDEL is an NGO that currently employs 300 staff and works in several districts in Uganda, reaching over 6,000 young people annually. Rogers has a BA in social work, an MA, and is a PhD candidate. As an experienced NGO leader and expert consultant on youth in sub-Saharan Africa, Rogers has worked extensively to research, implement programs, and inform policy on pervasive health risks, drug abuse, child labor, and child trafficking that face the youth population. Based on Mr. Kasirye's research on HIV/AIDS, alcohol, and street youth in Uganda and East Africa, he has served in a technical consultant capacity to inform research for the WHO, ILO, UNICEF, and various UN bodies. Rogers believes in early prevention as a person who has worked in low-resource settings. He believes in sharing experiences and building capacity. And with this regard, he currently also serves as the Deputy President of WFAD. Our next speaker will be Barbara Nakijoba, who is a social worker, monitoring and evaluation officer working with UDEL, Uganda Youth Development Link. She is a substance use prevention professional who is deeply involved in youth empowerment and has been involved in successful implementation of a number of youth empowerment projects in Uganda. She is passionate about mental health and is committed to helping vulnerable youth to develop protective factors and build their resilience in order to live better lives. With support from UDEL and the Baki Moon Center for Global Citizens, Barbara has designed an SDG micro project named Youth Take the Lead in Reducing Violence in Rubaga Division, which is contributing to Goal 16 of Peace, Justice, and Strong Institutions. The project is aimed at creating a safer and more peaceful environment for people dwelling in urban settlements of Kampala in Uganda. Last but not least, we are joined by Sumima Tiladha, who is the Executive Director of CIVIN Nepal. Sumima has extensive experience in child protection issues, child sexual abuse, and commercial sexual exploitation of children, street children, trafficking in women, children, child participation, and children in armed conflict. She has conducted and published various researches on different child protection issues. As an expert on child protection issues in Nepal, she is engaged in policy advocacy on children's rights and conducts awareness programs and trainings to different sections of the society, such as social workers, health officials, teachers, law enforcement agencies, and does this on a regular basis. As a founding member of CIVIN Nepal, Sumima has been working passionately towards these causes for the past 31 years in various capacities within CIVIN, where she currently serves as the executive director. Furthermore, And this is just a small bio from everything that our prominent speakers have done. But to round off, Sumima is also the national coordinator of the Nepal Alcohol Policy Alliance and is actively engaged in advocacy for the comprehensive national alcohol policy in Nepal. So we're very glad to have our speakers with us today and that so many people have joined us at this session. We will have time for Q&A at the very end, but until then, you're most welcome to ask your questions in the Q&A box and in the chat box, of course. And we would love to know who is here, so please introduce yourselves in the chat box throughout the session. So without further ado, I will hand over to Rogers and Barbara to introduce the research on victimization, suicide, and coping among vulnerable youth in Uganda during the COVID-19 pandemic. Over to you, Rogers.
Thank you so much, Regina, for that kind introduction and opening remarks about our organization. And also happy to see Sumina after a long while, and Cressida for the support you are giving us. I think WFAD has done a wonderful job, because if you are identifying slum children, street children, vulnerable young people who are found in the city, the question has been that what have we been doing for this population, especially during the lockdown? And when we discussed and we said we need to share, this was a subject which is very, very key to many people globally. And the question has been that what have we done for our people during this period? And fine, we have been locking down here and there, the countries have been locking down, but what about these young people? And how have they managed to cope? How have they managed to survive? So we are grateful that this subject is coming up, and this is an area we need to address, we need to focus on. And particularly when you look at issues of suicide, victimization, coping, it's an area which many professionals are neglecting. Actually, we have many people who are doing a lot of work, but in advocacy, in awareness, they are doing a lot of research, but actual intervention to reach young people, I think it is a problem, because very few people are being benefited. So we are grateful to some earlier work which was done, particularly by my mentors, Dr. Chinyanda, Monica Swan and Jen, Professor Mary Jane. All these have been trying to raise the issue of vulnerability, suicide, victimization, coping. How do we really help young people who are affected by this problem? And the studies which have been done in this country, normally they've been telling us that people who are HIV positive will likely to commit suicide. They also tell us that in the war zone, because we've had a lot of wars in my country, that people who are affected by war, suicide levels, ideation is likely to go up. The same in urban environment. They also discuss homelessness. But as we see in the presentation we're going to make, it appears that the epidemic introduced new dimensions, new risk factors, which had not been seen before, because the argument before has been HIV, war, homelessness, adverse childhood experiences and all that. But as we'll share with you, there are new things which came on board. And as people, practitioners, people who are involved in interventions, these are things we need to address, and these are things we need to act and we need to address. So if I request Cressida to help me with the PowerPoint presentation, I'll be grateful. Next. Of course, that's the topics. But which is UDEM, Uganda Youth Development League? We see a lot of young people, and we've been working since 1993. Some of the young people who come to our facilities have drug abuse problems. Some of them 30% experience homelessness. Actually, from our populations with young people we serve in the slums of Kampala, in our drop-in center, we have 80 drop-in centers and a very big facility. 15% have had a criminal record. They have interfaced with the juvenile, facilities, juvenile courts, and interface with the law. Some are exiting prostitution and sexual trafficking survivors. Next. Also see some from child labor, Cressida. With many challenges of runaway, no family contacts, experience stigma, a lot of trauma, hopelessness, and the economic side, they lack employable skills and deny of access to income, and survival crime is very high. Next. Next. Of course, I break down for you. You can see. We are going to share with you some of this, but we want to take you to the data. Next, please. Of course, in the previous studies which have been done in Uganda, for example, one which was done by Monica Swan, she interviewed over 1,132 young people, and she noted that suicidal tendencies were a little bit high, with a lot of depression. And what we have done is that we have compiled all these references and papers. You people, when you get time, you'll be able to access them. Next, please. Next. Okay, now we come to the study, and I'm going to request my other colleague, the young person whom we've worked together, Barbara Nachijova, social worker, to share with us what did we see when we interviewed young people.
Thank you, Mr. Rogers, for that wonderful presentation. I believe it is going to provide a solid foundation for our next topic of discussion and will enable the participants here to better understand the problem of victimization and suicide during this period of the COVID-19 pandemic. My name is Barbara Nachijova, and I thank you all for joining us today. Good morning, good afternoon, and good evening, wherever you're joining us from. So I'll be sharing with you about a study that we conducted with my colleague, Mr. Rogers, in 2020, that was looking at victimization, suicide, and coping among vulnerable slum youth during this period of the pandemic. Our study examined the factors that were associated with suicide, victimization, and coping among 583 slum youth who are former UDEL beneficiaries. Next slide. Our hypothesis was focused on homelessness, problem drinking, HIV, STI infection, and previously being raped, but also physical and child abuse. We hypothesized that all these factors would be associated with suicidal ideation, and our hypothesis was arose out of a desk review that we conducted, of a study that was conducted in 2018 by Dr. Monica Swan. COVID-19 generally has had a more devastating impact on the populations in Uganda, and we have never experienced a disease outbreak that had this much impact. It caused about so many drastic changes, and it left many actors like NGOs and the government were unready to actually respond appropriately in the short run. And as a result, most vulnerable populations were negatively affected. And according to research that has recently been conducted, it is no wonder that our baseline stress levels have gone up above 30%. And this is even worse for the most vulnerable populations. Next slide, Cressida. Our study, the rationale of our study was to provide insights into emerging coping mechanisms for the populations that experienced victimization and suicide, but also enable us to examine the psychosocial risk factors for suicidal ideation and victimization, but also build on a previous study that was conducted in 2018 by Dr. Monica Swan. Next slide. When we were conducting this study, we employed the cross-sectional design of methodology. We used surveys to conduct data, and this data was supported by information that was collected using the UDEL HEDES tool. All the 583 participants provided formal consent to participate in this study since they were emancipated minors. And also analysis focused mainly on key demographic characteristics that had been left out in the previous study. For example, parental status, nature of the family of the respondents, focusing on trauma, depression, victimization, suicide, OXEA, trafficking, livelihood and economic survival, substance use, and also looking at impact of COVID-19 on this population that we are looking at. Next slide. When we were analyzing data, we used descriptive statistics, which helped us to understand the relationship between suicidal ideation and victimization. Bivariate and multivariate logistic regression analysis were used to determine the association between suicidal ideation and hypothesized risk factors, adjusting them for socio-demographic variables. And all these analyses were performed using the SAS software. Next slide. According to our findings, socio-demographic features of the study participants showed that our population lay between the ages of 10 to 24 years, and majority of them were female, and this actually highlights the vulnerability of the girl child compared to their male counterparts. The study also showed that the population we were dealing with was highly illiterate. For example, 52% of the respondents had dropped out of school in primary level. And I think in the Western countries, this is elementary school. 59% of them lived alone, and 21% had ever been forced out of their home, or they were homeless at the point in time. And these statistics actually bring our attention to the weakening of the family institution, which is a strong protective factor against suicide and victimization. 34% were living with their spouses or boyfriends, and 47% had become victims of teenage pregnancies. And teenage pregnancy is another problem that actually has been heightened by the lengthy closure of schools. Since 2020, schools have been closed. And as such, the government of Uganda recently came out to provide a report where they recorded nearly 650,000 teen pregnancies between the period of 2020 and 2021. And this is significantly high. So I believe this brings our attention to the need for responses to some of these issues. Next slide. COVID-19, according to findings of our study, increased victimization, and majority of respondents reported experiencing victimization in terms of violence, harassment, sexual abuse, beatings, neglect by guardians or caretakers, food shortage, lack of money, and many other challenges. Next slide. COVID-19 also heightened vulnerability of girls as far as coping was concerned. And according to our findings, we recorded that almost half of the female respondents felt disappointed and hopeless. 47% were worried and stressed, and it is as a result that 116 of the female respondents experienced suicidal ideation. Next slide. This graph shows us the impact of COVID-19 social control measures or the lockdown effects on this vulnerable population. When the government of Uganda closed down all sectors or passed a total lockdown, businesses closed down, capital was eaten up, and as a result, this population experienced financial problems which shot up to 54%, which is significantly high. Child-headed households and other families that were surviving on a hand-to-mouth basis became more distressed as they had no idea where their next meal was going to come from. And food shortage shot up to 56%. 48% of the respondents became homeless as a result. 20% were abandoned by their caregivers who could no longer take care of them. 14% experienced parental loss due to the COVID-19 disease, but also due to other factors. Violence in general went up in terms of intimate partner violence, gender-based violence, domestic violence, and other forms of physical violence and abuse. And majorly, this was due to the fact that most of the household heads were not able to actually provide for their families, and also having to spend a lengthy period of time in a small space. It is important to note that the population that we are looking at, usually they live in one single roomed house. You could find a family of 6 to 10 people having to survive in a single roomed house for this lengthy period of the lockdown. So it is no wonder that domestic violence went up during this period. The other percentage, which actually tried to look for employment outside the home, reported experiencing being victims of child labor, and another 16% experienced trafficking as a result. Next slide. In a bid to cope, this population resorted to alcohol and substance use. And as you can see on the graph, alcohol was the most abused substance in this regard. And this is due to the fact that it was more accessible within the communities where this population resides. Another set of respondents reported coping in terms of engaging in transactional sex, naked stripping, nude photography, but also OXEA went up, which is online child sexual exploitation and abuse, as children spent more time having to learn virtually online. Next slide. COVID-19 generally heightened vulnerability of most at-risk populations further. And according to this study, we recorded 21% of the respondents experiencing suicidal ideation, and a larger number of these were female, which is 116. We also recorded 8 deaths as a result, and victimization was also high at 54%. Next slide. When the respondents were asked what were their most urgent needs, how would they want to be supported, these were some of the ways they mentioned. The first one was receiving vocational skills training, being provided with employment, and also food relief. When UDEL found out about the plight of this category of vulnerable slum youth, they responded by providing food relief, which is in the graph that is on the extreme right. They were also provided with cash transfers, which they used to clear rent arrears, but also start up small and medium enterprises to enable them to be able to earn a daily income. 87% received support in terms of vocational skills training. Next slide. Thank you so much. My colleague, Mr. Rogers, is going to come in and share with you the support that was provided, or response that was provided by UDEL, but also recommendations that were made from the study. Thank you so much.
Okay, thank you so much, Barbara, for sharing. I think what this chart is showing you really is what we felt was important, given the feedback and views of young people. Food relief was very critical during COVID lockdown. We had actually to give money, thanks to organizations like Plan International, Oak Foundation, thanks to some friends of ours, like Bread for Life, LWF, some professors gave money to buy food. We had to give actual money because life became so unbearable. Actually, even the training had to change a little bit. Instead of training young people in a big facility like a school, we had to go to homes and do it from homes. Long-term vacation was a little bit suspended because you couldn't do much and you couldn't do more. A lot of radio and peer education was also promoted. You'll be able to see some of these things in the presentation later. Next, please. Now, what do we see in terms of the findings? In Kampala city, in our town, that out of every five young people you see, one is experiencing suicide, and that is a serious problem. Interventions for mental health, for suicide support against suicide, we must do act very hard. And the affected age is 15 to 17. Yes. And the age is going younger compared to what Monica Swan have seen, Professor Bukuluchi have seen, particularly for slum population and Kinyanda. The age is going younger, and this is really worrying. Because if you're having young people who are beginning to think about suicide, then something must be done. And lack of family support and lack of contact with family. And I don't know how interventions are done if there are no family. As you know, you need to work with the individual, you need to work with the family and the community and the environment. But also ignorance about where to seek advice and where to seek support. And all these are challenges we need to do, what we need to address. And worst of all, the major perpetrators of violence, and making life for young people are the people known to their people. So in other words, now how do you begin to address this? The assumption will be that it's the other people, law enforcement system, no, young people. But also social and other social intervention were very scarce. Next, please. Next. What are the implications now for the risk factors? With slum young people, what we have seen is that you need to identify the risk factors. The family strain is very, very key. Witness of violence by young people is a suicide, can precipitate, can ignite. Unemployment or employment, lack of food among homeless people, deprivation, even taking away the little they have away from them, lack of access to money and to income. Because many times we tend to think that they maybe need clothing, we give clothing, they need to travel. But in such a situation, really the things are a little bit different. So we need to prepare for emergencies. Individual and environmental risk factors are very key. Next, please. You may have to jump. Next. So what are some of the recommendations which have appeared to be working and which will work for some communities? I think economic empowerment, having access to money now, not yesterday, but now, not in the future. Cash transfers appear to have more impact. And in fact, we are analyzing the young people who benefited from the cash transfers. What changes have we made? Because if vocational skills cannot work, then what else can we do for them? Food relief, of course, psychosocial support. We have to prepare young people, the peers, fellow young people to do psychosocial support where we cannot reach and where we cannot go. Strengthening support systems, early prevention of drug abuse. I think this is WFAD, that's where you have to do a lot of training and support. Early prevention of substance abuse and drug abuse. Of course, vocational skills and shelter also work. Next. Of course, we are showing you some of the things we had to do, sanitizers, we had to buy a lot of hygiene soap, we had to give them masks. All these, they needed them because everybody was on panic, everybody was on tension. Next. Next question. Of course, food, thanks to the supporters, those who supported us, the peer education. Next. 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 What we have done, we are sharing you with our social media handle. Next. so that we are able to learn. But what we have done is through the Secretary General, Regina, we've sent our presentation, and you please feel free to share our presentation and share. But we are very grateful for the time offered to us. And there are 1 or 3 lessons we've learned, that in a pandemic like this one, the young people themselves are very important. Involve the young people in the interventions. Involving young people in the intervention is very critical. The second thing we have done is that we need to prepare ourselves as social workers, as people who are intervening, that not every time is going to be Christmas, there are going to be emergencies. Staff must be prepared to be able to work, to be able to intervene in emergency situations. The third option is that if we are coming in a lot of developing countries and the whole country is on hold, how do you intervene? How do you manage? So empowerment of staff, empowerment of social workers, even empowerment of community, because that what we saw is that most of the work went back to the families, went back to the community, the slum community. Everybody had to act and to work. But also there are going to be young people who will be totally homeless. You need to provide a shelter. We are very grateful for WFAD. We are grateful for you participants for allowing us to share. We'll be around to answer some of the questions. Thank you very much.
Thank you very much, Rogers and Barbara, for introducing this very important and much needed study in the paper that you have conducted together, and for highlighting not only the developments that we've seen or that you have seen throughout the pandemic, but also providing some recommendations and valuable tools in moving forward, and the need to develop these robust and holistic approaches that are integrated within social protection. And of course, and what is particularly important, to involve young people in this work. So thank you so much. We will, like you said, send out the paper afterwards to participants so that you could read the study in full. And we will now move on to hearing about perhaps similar situation, but about the situation of the COVID pandemic in Nepal. So I welcome Sumnima to take the floor, and very much look forward to hearing about your expertise from Nepal.
Very much. Thank you very much, WFAD, Regina and Cressida, for organizing this webinar. And I cannot thank enough my dear friend Rogers and Barbara for a great presentation. The study you have done is a true reflection of the situation young people in Nepal are also going through. It is just such many similarities that we both countries have, although we come from different parts of the world, but the situations being faced by vulnerable young people are so very similar. And I'm sure this applies to all the young people living at risk situations around the world, because the disparity, the lack of access, and so many vulnerabilities they face are so similar. It is also a reference for our work as well, what you've done. And we are actually doing so many similar actions, Rogers. That's why we are friends. That's why we are in the network. That's why we are in WFAD. Thank you so much. I will actually focus on the real situation and the very, very recent situation. We are also yet to do a study similar to you, Rogers and Barbara, and we actually also have similar stories to tell, so many similar stories to tell. I will focus on the street-connected children and young people that we work directly with, and I also have in the participants list my colleagues who work so hard day and night on the field, like literally 24/7. Next slide, please. So when we are talking about vulnerability, they are actually much more vulnerable when they are using drugs. I'm also focusing on the use of drugs and the vulnerability level increased by the use of drugs among the children who are connected to street or who live in the slum or urban poor areas. So their physical and mental health are deeply impacted, and they have all the possibilities of contracting HIV or hepatitis, and also COVID infections are also high among these young people because they live in a situation where like staying home does not work at all, and access to hygiene communities are also there. And due to their addiction and unsafe behavior, they are like becoming much more vulnerable to sexual exploitation and are also driven to criminal activities, who are actually used by gangs in criminal activities for their own vested interest. But these young people are actually often criminalized and charged by authorities. So they are like facing double jeopardy. They are living in such a harsh situation, but at the same time are also being victimized, sometimes for doing drugs, sometimes for selling, and sometimes for being, used in criminal activities. Next slide, please. So when it comes to suicide, Nepal actually comes among like one of the top 3 or 5 countries where young people's suicide rates are really high. In Nepal, we actually looked at the data from 2020, and we found that about 20% of the suicides happen to children under the age of 18, and that's also alarming. And when it comes to young people who are living in a very, very risk situation, such as street-connected children and young people, their situations are definitely very, very vulnerable, as also presented by Roger and Barbara's studies. It's just some of these stories are like horrifying. I just spoke to my colleagues who work directly with street young people during the lockdown, and these few stories are just from the last 3 months. An 18-year-old boy died by suicide after getting high on drugs. He was just telling everybody that now there is no future for him, and I want to die, and he actually died. He just hung himself by a curtain or a bed sheet, and he was found dead. And when he was taken to the hospital and postmortems were carried out, and drugs were found in his blood for sure. And then another 19-year-old boy who died from COVID was found intoxicated with drugs. He died in a public hospital, and he had nobody to do his funeral. So the street field workers actually went and conducted the funeral rites for this young boy. And on the left side, this photo was taken on the day this boy was cremated. So another 20-year-old boy recently died from tuberculosis, who actually was on heavy drugs and did not continue his treatment for tuberculosis. Otherwise, he would have still alive. He would have been still alive. So these are just like a few stories from just last 3 months, and several such stories are underway. And that's where we need to gather all the courage and all the efforts to save these precious lives. Next slide, please. So these young people are living in very, very vulnerable conditions. So many similarities to the young people living in Uganda or Kampala streets as well. So these, like young people during the COVID pandemic were facing much more vulnerabilities than before. Like firstly, because of the lockdown, their income sources were gone. And then secondly, due to the lockdown, their, like access to all other like linkages and connections were also getting lost. And the street field workers actually had to go to where they were living, you know. They were like living in such bad conditions that some of them literally had to be lifted and brought to hospital or brought to a support. So I'm really, really proud of our colleagues who like actually risked their health, and all of us were working from home and staying home, but then they were on the field 24/7. Next slide, please. Yes. So these young people were like having very bad time, and they had no food, and the scarcity of food was like really pressing, and they had no access to like nothing. But even in those days, all kinds of drugs were available. These were photos taken by our field workers who, when they went to rescue these young people, found like many these substances lying around, you know. So the availability is one of the issues. When the food is not available, when the milk is not available, alcohol or all kinds of drugs, marijuana or IV drugs or prescription drugs were available. And when they were going hungry, empty stomach, and they were actually taking all these drugs, and that actually made them much more vulnerable to succumb to serious illnesses. Next, please. So as you are going about in Uganda, in Nepal, we are also working really hard to reach out to these young people and to give them a dignified life. And building resilience is one of the strongest interventions that we actually do together with our peer educators. We have trained peer educators who belong to streets or who have had lived a life on the streets or who have had done drugs, etc. And they have become peer educators, and we mobilized them. We provided them with orientation so that they were able to go like corner to corner to meet these street connected children and their families, and find out about their, you know, like current situation, if they were going hungry, if they were sick, if they needed like hygiene materials, if they needed emergency food support. These peer educators found that out, because for all the organizations it was difficult to go to where the street connected children or people were. So we mobilized the young people from within that community, whom, you know, like these people trusted, and came and spoke to them and asked for help. And these peer educators actually facilitated many emergency support to hundreds of street connected young people and their families. So we also distributed like emergency food support that included, you know, like support for like buying gas or other MTs. And also we tried to find like separate, you know, spaces so that they come out from a very bad living conditions, and at least, you know, get a safer place to stay at, and get access to medical support when they needed, when they were having fever or other even like preventable diseases. They were not, you know, like getting access to any medical support. So our peer educators and field workers actually also facilitated all that support, and we mobilized one of our network organization, CPCSs. They have an emergency vehicle ambulance, and we also mobilized that. And during the time of lockdown, we also were able to mobilize some of the government vehicles who provided that support, and we were able to reach out to the most vulnerable. During the pandemic, more young people, became jobless. They already did not have much like promising jobs, but during the lockdown, even small incomes they used to get were not happening. So we are now focusing on self-reliance support that includes like vocational training, or we are also providing some funds for their startups, small startups. And mental health support was one of the important aspects of our work, and we have the privilege of having Nepal's first child and adolescent psychiatry unit being run jointly by CIVIN at Kanti Children's Hospital, supported by our partner organization Forut. And these young people were able to take help from long distance counseling from the expert child psychiatrists, child and adolescent psychiatrists at the child and adolescent mental health unit. So continuous field work happened from the joint group of street field workers forum. This forum is initiated by CIVIN and has about 7 or 8 members who are like very, very directly working with street connected children and young people. They are working together, they are sharing cases, they are referring cases to each other and keeping book logs, and they are able to actually identify the vulnerable young people and reach out to them whenever they are in need. They go to bed like 2 o'clock in the morning or 12 midnight, and they work like in not only in odd hours, but they sometimes have to, for example, bring the dead body from hospital or bringing it for the funeral rites. So all kinds of humanitarian, like assistance work is being carried out by this group, and we're very, very proud of having such committed people who are actually connecting with street children or their families, and trying to build resilience and trying to like support them to live at least a little more dignified life. Next, please. So one of the important works that we did during the pandemic was bringing many children and young people for vaccination, because these young people who are living a vulnerable life in street-like situation or in the slum areas, who sometimes do not have their families, they are living on the streets, far away from home, and they do not have any ID cards, they do not have a citizenship card or a birth registration, and that actually deprives them of getting access to vaccination as well, because the government of Nepal has made it mandatory for all of us to bring our ID card to get vaccinated. So these young people we work with, they do not have any. And we tried hard to lobby with the local government, and we were able to gather more than 50 young people also in the picture. They were able to get vaccination. And that also like worked as an awareness among the street connected families, because about 20 to 30% actually shied away from going for vaccination because they're not aware about the benefits of vaccination, and they have heard all those rumors about vaccination killing people, etc. So that actually also worked as awareness raising among these communities, and our peer educators helped a lot in getting people aware about the benefits of vaccination and getting them access to vaccination. And at this moment, just a day before, my colleagues, including the chair of CIVIN, had a meeting with the network members, where we are trying to bring the concern from the Ministry of Health itself for the vaccination of young people under the age of 18, because in Nepal, we have now started vaccination for children under 18, the Pfizer vaccine. All the many school children have now got it, but none of the children on the streets or in the slum areas have had access to it, because again, they're not going to school, they're where they could get it, to the health post, they could get it, but they do not have any ID cards or identity. And for that, we are trying our best also to reach all the way up to the minister to bring this concern about young people without families or who are living in street-like situations to get vaccinated. Thank you. I think this is the end of my presentation.
Thank you so much, Mima. It is, I really am just in awe of the work that you have done throughout this pandemic. And it's so interesting as well to hear about the similarities between the two countries, even though, you know, they're so far apart. But to see also the involvement that you and your team, your colleagues are doing in terms of advocating towards local governments and national governments and building this resilience among youth, and really also highlighting something that Roger said about, you know, incorporating the children and the young people and doing so through this peer support and these peer educators is just a fantastic highlight of this good work. It's also so interesting about, you know, identity cards and the way that the lack of an identity card can really showcase the differences between children and children, so to speak, or the rights of the children, and the fact that it's so important to just access, you know, equal rights in terms of vaccination and other interventions. So thank you so much for that. It's very interesting. And for those of you who have questions for Sumima or Barbara or Rogers, please feel free to write them in the Q&A. We already have 2 questions here, but I would like to ask them again. So in case somebody hasn't read the answer, we have one question that asks, based on what Roger said about the youth needs to be a part of the intervention. So I thought I'd ask you, Sumima, and then Barbara and Rogers, this question: what are the best ways of including youth in the interventions? Perhaps you can go first, Sumima.
Okay. Yes, it is very important that young people themselves, become actors for the change that is desired for them, because the life they lead, the dreams they have, the aspirations they have are, best known to them. And when they become a part of the action, only then they will own up, they will want the change for themselves. And that is very important. And especially for these young people who are doing drugs, who are into using substances, or who are facing mental health issues, it is so important to make them, feel, included. It is very important. That is actually the beginning of starting any change in an individual or the whole community. Sometimes an individual who becomes part of the change and who becomes, an actor for the change that is desired, then that actually message can actually lead to much larger change. And to do that, one of the things we can just do is respect their views. Sometimes even our government body, one of our nodal body for child protection or child welfare, they do not believe that children on the streets are still suffering as we present to. They think that we are exaggerating, just also to make the government authorities and the stakeholders realize young people need to take the stage, take the front stage and ask questions. And for doing that, they need to be empowered. They need to understand their rights and stand for their own rights. Thank you.
Thank you. So well put. I wonder if Barbara Rogers would like to answer as well.
Thank you, Regina. I'll respond to that question. In terms of, I agree with the seminar, what she has shared with us. It is very, very important for youth to be involved in interventions because this brings about ownership of the intervention. And some of the recommended ways of engaging youth that we have been using here at UDEL, we usually train them as peer educators, and then we send them out to the communities to conduct awareness raising amongst their peers. We also train them to do brief trauma screening. And actually recently we have some of our peer mentors who have been taken on by a health facility to do HIV testing and counseling. And this will motivate the peers to actually go for HIV testing and counseling. Then we also engage them in music, dance, and drama, and also sports, because these are very important ways of getting them to open up. Usually the categories that we work with are vulnerable and they come to the centers feeling down, but then when you give them an opportunity to participate, maybe in sports, in music, dance, and drama, and also sometimes using, I don't want to really say art therapy, but having to draw up some of their feelings or even write them down. This gets them to open up, and sometimes this is also a rehabilitation measure. Thank you so much. I'll also give my colleague, Mr. Rogers, to share.
Briefly, what I would like to share with our colleagues is that the involvement and the participation of young people is very critical and very important. One is that, of course, the SDG, the Sustainable Development Goal, and also in the African Union, they are really talking about child participation. And when we talk of child participation here, we are looking at empowering young people to be in the driving seat. If you have a situation of COVID, if you have a situation of suicide, facing violence and victimization, but also coping. Of course, there are going to be negative responses and the way they respond, but also positive responses. What you do, you empower the young people, train them so that they're able to disseminate, to pass over the information to their colleagues and become change agent. Empowerment also increases the protective factors the young people have. They will know where to report, where to go, how to seek assistance in a proper, positive way. You are increasing protective factors, but also you are doing youth development. You are empowering them to be, role models who can help. But also child participation will require that maybe involve the alumni, those who have been with them, those who have been in it, to work and participate. That is my quick view, but child participation is very important in intervention that help young people, because you reach young people more. For example, in a lockdown, when everything is locked, who will go and reach young people? Who will tell them about the services? The peers will reach out more and reach out more. Thank you, Regina.
Thank you so much, Rogers and Barbara, for this contribution. I think we should end in a few moments, but I just wanted to ask you, all three of you, if you have any final words before we finish for today, or if anybody in the participation would like to ask final questions, please do so now. But from my end, I would like to just know a little bit about the gender differences. I know it was highlighted quite thoroughly in the study that you've both done, but if you see any particular gender differences in the methods and the tools for change, and then afterwards the same question to Samima.
Okay, can I start? On the gender briefly, and also as I wind up, is that, of course, in Uganda, we are around 42 million, almost slightly above 50 to 60, they are mostly women and female. We have a very big population of ladies or women. And also in terms of our culture, and women are normally kept behind. Women don't get access to services. You see, the way our services are organized, they are taken to the slum communities, to the ghetto, to the places where young people will really get more affected. So men are normally elevated, but girls will find it a challenge. So we find that girls respond more to our intervention, to our programs that safe space and the drop-in centers, which we learn in the entire city of Kampala, and we are the biggest. That's why in terms of data, we will give you more about women and what. But the other lesson we have learned is that also we need to reach out to the girls. Girls are very vulnerable. Girls are hit by victimization. Many girls are facing suicide because they are largely a neglected population. And this population needs to be empowered. This population needs somebody to come and address and do something. So interventions which are gender inclusive, gender sensitive, but also which increases resource and protective factors and youth development asset will help improve the lives of girls. Thank you very much. Maybe Barbara and then Somina.
Thank you, Regina, for that question. I also agree with Mr. Rogers, because in Uganda here, the girl child is usually affected by cultural aspects. They are left behind, they're not enrolled into school because money is set aside to cater for the male child. The male child is given priority over the girl child because they believe, society believes that the girl should just be taking care of the home and looking after children or giving birth. So that is why we have a higher number of female beneficiaries in our coming to receive our services, but also being more vulnerable than their male counterparts. Thank you. That is all from me. I think Somina can respond now.
Sure. Thank you. Thank you, Regina, for this important question. You know, Uganda and Nepal, so far away, poles apart, like geographically, but we live in a similar situation. So that's why we need a lot of solidarity among all of our organizations, you know. So in Nepal also, definitely, we're still you know, suffering from the patriarchal mindset, not only in the communities or in the families, but at the state level, the kind of laws that is discriminative, etc. But when it comes to the street connected, you know, like the young people, the gender dimension is something that actually reflects our society. Even within this community, girls are much more vulnerable to exploitation. And there are early marriages because the girls actually, even if they live on the streets with 7 boys, you know, they need to get married to one for the sake of being protected by this man. Otherwise, she would be raped, gang raped by all other like six men. So that the kind of situation occurs, and when the girls are on the streets or are living in like urban poor areas or in slum-like conditions, they're much more vulnerable, not only to sexual exploitation, but they become like young mothers, and they sometimes lose their lives. We had a case during last year. One girl, like only 14 or 15, gave birth to a child. The infant actually could not survive. And right at the moment, in the afternoon, we had a meeting with our team who works with street connected young families. This 19-year-old girl gave birth to a baby girl. She has like a critical condition. She is in critical condition because this girl, when she gave birth, was like malnourished. This in baby, just in infant, you know, like newborn has all the vital organs, you know, like problems, and we are trying to get support from the hospitals. The costs are so expensive. So what will this girl do? And she does not even know who's the father of this baby. So like added responsibility when they bear children, and added vulnerabilities when they are on the streets, when they are doing drugs, even more vulnerable, because they are not only like, you know, they are drug using themselves, they are like forced to do drugs for the benefit of, you know, like the sex work they do. So it's a very, very hard situation for a girl or a woman to be on the streets in Kathmandu and I think elsewhere in the world.
Definitely. The vulnerabilities of girls is something that I think all of us, no matter the region or the country that we're in, have experiences of within the field that we work with. So it's important that we, like both or all three of you have said, have keep this in mind and make sure that our interventions are gender sensitive and gender transformative and include everyone in these interventions. And with that, I would like to thank you for these final comments and highlighting not only the gender differences, the situations in the two countries that you work within, for these two great presentations that have so brilliantly highlighted the need for community ownership, the involvement of youth in programs to ensure integrated approaches and gender sensitive interventions. So thank you to our speakers, to our guests, and of course to our colleagues who are working with PowerPoints and in the background and sending information out to everyone. And we will send to all of you who have been here today the paper that Rogers and Barbara have done, or the study that they have conducted, as well as the PowerPoints. And I hope to see you all again in our upcoming webinar. So thank you so much for being here today.